Have you ever paused to question, as I have, whether the blood pressure medications you rely on are genuinely safeguarding the health of your blood vessels? As a cardiologist with over 3 decades of experience, I'm here to unveil a startling reality about vascular health that's rarely discussed with the candor it deserves. The truth is both eye-opening and urgent. Vascular disease claims the lives of 1 in 3 Americans today, a statistic that underscores the silent epidemic coursing through our society. In my practice, I've observed that a staggering 80% of patients in their 70s grapple with vascular complications, ranging from stiffened arteries to dangerously narrowed blood vessels. Yet, what's even more alarming is that many of the medications prescribed to manage these conditions fail to address the root causes of vascular deterioration. This is a critical insight that the medical community rarely shares openly, and if you don't read on, you risk allowing your blood vessels to degrade progressively, like a ticking time bomb threatening your health. With 30 years of clinical experience treating thousands of patients, I've witnessed firsthand the limitations of conventional treatments. Blood pressure medications, for instance, often provide a temporary reduction in arm blood pressure readings, creating a false sense of security. Meanwhile, peripheral blood vessels, those critical smaller arteries and veins throughout your body, may continue to deteriorate, becoming less flexible and more prone to blockages. Similarly, diabetes medications artificially lower blood sugar levels but often sidestep the core issue of insulin resistance, leaving patients vulnerable to ongoing vascular damage. Cholesterol-lowering drugs, too, can be likened to bailing water from an overflowing sink while the faucet remains wide open, especially if dietary habits, like consuming greasy, processed foods, persist unchecked. My name is Dr. John Carter, a 78-year-old cardiologist who has dedicated my career to unraveling the complexities of heart and vascular health. Through decades of research and patient care, I've uncovered powerful, natural strategies to restore vascular vitality without an over-reliance on pharmaceuticals. Surprisingly, the most effective solutions aren't found on pharmacy shelves but in the foods you choose to put on your plate. Obesity, a growing concern in modern society, places immense strain on your vascular system. Excess body fat doesn't just sit idly. It demands its blood supply, forcing your heart to work harder to pump blood through an ever-expanding network of vessels. As body weight increases, so does the length and workload of your blood vessels, leading to elevated blood pressure and heightened cardiovascular risk. Overuse of blood pressure medications, while sometimes necessary, can come with serious downsides, including kidney damage, dizziness, and an increased risk of falls, particularly in older adults. These drugs often act as a temporary bandage, masking symptoms without addressing the underlying causes of vascular decline. What I'm about to share is information that pharmaceutical companies would prefer to keep under wraps. Knowledge that empowers you to take control of your vascular health naturally. Consider the case of a 65-year-old patient in my clinic who, despite faithfully taking 3 different blood pressure medications for over a decade, continued to struggle with unstable blood pressure and worsening vascular health. After just 6 months of adopting the natural, evidence-based methods I'll outline, he was able to reduce his medication dosage by half, significantly improving his quality of life. Another patient, a 58-year-old woman with dangerously high cholesterol levels, saw her numbers normalize within 3 months simply by incorporating specific nutrient-rich foods into her diet, foods I'll reveal shortly. The key to vibrant vascular health lies not in a pill bottle but in balancing targeted nutrients and adopting sustainable lifestyle changes. No medication can replicate the transformative effects of the strategies I'm about to share, which I'll guide you through step by step. Let's start by addressing a critical question. Do you know the toll that your daily medications may be exacting on your liver and kidneys? These vital organs bear the brunt of processing the drugs you take, and over time, this burden can lead to serious complications. Today, I'll delve deeply into 2 powerhouse nutrients, vitamin K and unsaturated fatty acids, that can revolutionize your approach to vascular health. If you find this information valuable, please consider subscribing and sharing it with others who could benefit from this life-changing knowledge. Let's begin with the first secret. Vitamin K, the unsung hero of vascular health that deserves far more attention than it receives. Most people associate vitamin K solely with blood clotting, but its role in maintaining healthy blood vessels is nothing short of remarkable. Vitamin K acts as a critical shield against vascular calcification, a process where calcium deposits accumulate in your arteries, causing them to harden like rusty, inflexible pipes. This loss of elasticity drives up blood pressure, overworks the heart, and increases the risk of heart attacks and strokes. Vitamin K's primary function is to regulate calcium distribution in your body, ensuring it's directed to your bones, where it strengthens your skeleton, rather than lodging in your blood vessel walls, where it contributes to dangerous plaque buildup. Think of calcium in your arteries like limescale clogging an old kettle. Over time, it restricts blood flow and compromises vascular function. A landmark 23-year Danish study involving over 50,000 participants found that individuals with adequate vitamin K intake had a 34% lower risk of developing peripheral artery disease, a condition marked by narrowed arteries in the limbs that can lead to severe pain and mobility issues. If you stop reading now, you'll miss the most potent strategies for keeping your blood vessels youthful, flexible, and free from calcification. For decades, many of my patients suffered silently with vascular issues, unaware of vitamin K's pivotal role in their health. Fortunately, this nutrient is abundant in accessible, everyday foods, particularly dark green leafy vegetables like spinach, kale, and collard greens. Here's a practical tip. Vitamin K is fat-soluble, meaning your body absorbs it best when consumed with healthy fats. Pairing spinach with a drizzle of olive oil, for example, can boost absorption by up to 5 times compared to eating it alone. Be wary of vitamin K supplements. About 90% of those available on the market are poorly absorbed due to inferior formulations. Instead, I advise my patients to lightly sauté spinach or kale in extra virgin olive oil to maximize both flavor and nutrient uptake. The darker the green, the richer the vitamin K content. For context, a single cup of cooked spinach provides approximately 145 micrograms of vitamin K, while collard greens offer even more, at around 200 micrograms per cup. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. The recommended daily intake of vitamin K for adults is 90 to 120 micrograms, but for optimal vascular health, I recommend aiming for 180 to 200 micrograms daily, a target easily achievable with a serving of leafy greens. Vitamin K exists in 2 primary forms: K1, found in plant-based sources like greens, and K2, found in fermented foods such as natto, certain aged cheeses, and grass-fed butter. Research suggests that vitamin K2 is up to 7 times more effective at preventing vascular calcification than K1, as it more efficiently directs calcium away from blood vessels. In my practice, patients who incorporated K2-rich foods into their diets saw measurable improvements in vessel flexibility, with some experiencing a 15% reduction in arterial stiffness within just 3 months. For maximum benefit, pair vitamin K with vitamin D, which enhances calcium absorption in bones through a synergistic effect. However, a word of caution: if you're taking blood-thinning medications like warfarin, consult your doctor before increasing your vitamin K intake, as it can interact with these drugs. Now, let's turn to the second cornerstone of vascular health: unsaturated fatty acids. One of the most pervasive myths in nutrition is that all fats are harmful, a misconception that has led many to shun fats altogether, to the detriment of their health. The truth is that the right kinds of fats, specifically unsaturated fatty acids, are essential for reducing inflammation in blood vessels, lowering harmful LDL cholesterol, and maintaining thin, flexible vessel walls. The key lies in achieving a proper balance between omega-3 and omega-6 fatty acids, ideally at a ratio of 1 to 4. Unfortunately, the modern American diet, heavy in processed foods, vegetable oils, and grain-fed meats, often skews this ratio to 115 or even 125, promoting chronic inflammation and thickening of arterial walls. This imbalance is a silent driver of vascular disease, yet it's rarely addressed in standard medical advice. I recall a 60-year-old patient who came to me puzzled, saying, "Dr. Carter, I take a spoonful of sesame oil every day for its health benefits, so why are my vascular tests getting worse?" While sesame oil contains healthy fats, it's rich in omega-6 fatty acids, and without sufficient omega-3 to balance it, excess omega-6 can exacerbate inflammation, undermining vascular health. To correct this, I recommend incorporating plant-based omega-3 sources such as flaxseed oil, chia seed oil, walnuts, and chia seeds into your diet. Among nuts, walnuts stand out for their high omega-3 content. However, plant-based omega-3, known as ALA, converts to the more bioactive forms, EPA and DHA, at a modest efficiency of 5 to 10%, so it's wise to include animal-based omega-3 sources like fatty fish, mackerel, salmon, sardines, or tuna, for optimal benefits. One patient who added mackerel to their diet twice a week saw their triglyceride levels plummet from 200 to 120 milligrams per deciliter in just 3 months, alongside improvements in arterial flexibility. To bring this all together, the path to lasting vascular health doesn't lie in a prescription pad but in informed, intentional choices about what you eat and how you live. By prioritizing nutrient-dense foods like vitamin K-rich greens and omega-3 packed fish or seeds, you can address the root causes of vascular decline, reduce your reliance on medications, and protect your heart and blood vessels for years to come. The strategies I've shared are grounded in decades of clinical observation and scientific evidence, and they've transformed the lives of countless patients in my practice. If you're ready to take control of your vascular health, start with these simple, powerful changes today, and stay tuned for more insights to keep your body thriving. To optimize cardiovascular health and effectively manage cholesterol levels, incorporating omega-3 rich foods into your diet at least 2 to 3 times per week is highly beneficial. A standout choice is extra virgin olive oil, a nutritional powerhouse packed with omega-3, omega-6, and oleic acid. These components work synergistically to promote bile flow, which helps flush excess cholesterol from the body, reducing the risk of arterial buildup. Additionally, extra virgin olive oil contains hydroxytyrosol, a potent antioxidant that enhances insulin sensitivity, making it particularly valuable for individuals with diabetes or those at risk of developing it. A common concern among patients is, if my blood sugar is high, should I be consuming more oil? The answer is a resounding yes. Unsaturated fats, like those found in olive oil, slow the absorption of carbohydrates, preventing sharp blood sugar spikes and promoting more stable glucose levels. The American Heart Association recommends consuming approximately 2 tablespoons of extra virgin olive oil daily, ideally unheated, to preserve its bioactive compounds. Drizzling it over fresh salads, roasted vegetables, or whole grain dishes is an excellent way to incorporate it into your diet. For optimal benefits, avoid trans fats, commonly found in margarine, shortening, and processed snacks, as well as excessive saturated fats, which can solidify in blood vessels, much like they do at room temperature, contributing to plaque formation. In my clinical experience, approximately 80% of patients who adopted these dietary changes were able to reduce their dependence on cholesterol-lowering medications within 6 months, highlighting the transformative potential of these strategies. Another underutilized yet highly effective tool for cholesterol management is phytosterols, plant-based compounds that mimic cholesterol structure, tricking the body into reducing its cholesterol production in the liver and limiting intestinal absorption. Despite their remarkable benefits, only about 2% of the general population is aware of phytosterols' cholesterol-lowering properties. These compounds not only lower LDL, bad cholesterol, but also reduce blood vessel wall thickness, combat inflammation, and help prevent obesity. The American Heart Association endorses phytosterols, with research indicating that a daily intake of 2 grams can reduce LDL cholesterol by up to 10%. Phytosterols are naturally present in foods such as camelina oil, extra virgin olive oil, pistachios, almonds, broccoli, cauliflower, and Brussels sprouts. For optimal absorption, pair these foods with healthy fats, as phytosterols are fat-soluble. While a typical diet provides only 200 to 400 milligrams of phytosterols daily, achieving the therapeutic 2-gram target often requires intentional food choices or fortified products. Although phytosterol-fortified margarines and yogurts are available, natural sources are generally safer and more nutrient-dense. Beyond cholesterol management, phytosterols also support prostate health, particularly in aging men, making them a versatile addition to a heart-healthy diet. However, individuals with a rare genetic condition called cytosterolemia, which affects phytosterol metabolism, should limit their intake and consult a healthcare provider to determine safe consumption levels. Together, the combination of vitamin K, unsaturated fats, and phytosterols forms a powerful golden triangle for maintaining optimal vascular health and preventing cardiovascular disease. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Let's explore 3 exceptional foods that can significantly enhance your heart-healthy diet. First, camelina oil, a staple since ancient Roman times, is a nutritional gem, boasting an impressive 90% unsaturated fat content, including omega-3, omega-6, and omega-9 fatty acids. It also contains tocopherols, a form of vitamin E, and phytosterols, with an ideal omega-3 to omega-6 ratio of approximately 2 to 1, which helps reduce inflammation and supports cardiovascular health. In a small clinical study, patients who incorporated 1 to 2 tablespoons of camelina oil daily into their diets for just 2 weeks experienced significant reductions in total cholesterol, triglycerides, and blood pressure. 4 added benefits. Try combining camelina oil with garlic, which has vessel-softening properties that further enhance cardiovascular health. Second, extra virgin olive oil remains a cornerstone of heart-healthy eating. Its ability to promote bile flow aids in cholesterol clearance, while its hydroxytyrosol content improves insulin sensitivity, making it a valuable tool for blood sugar management. To maximize its benefits, use it unheated. Drizzle it over salads, dips, or roasted vegetables rather than cooking with it, as heat can degrade its delicate compounds. Third, flaxseed oil is a potent source of omega-3 fatty acids, with approximately 60% alpha-linolenic acid, ALA, making it one of the richest plant-based sources of omega-3s. However, flaxseed oil oxidizes quickly, so it should be consumed within a month of pressing and stored in the refrigerator to maintain its potency. Alternatively, whole flax seeds are an excellent choice, as they minimize oxidation and provide additional fiber. Some individuals also use flaxseed oil for oil pulling, a traditional practice believed to support oral health and detoxification. When selecting oils, always opt for cold-pressed varieties for raw consumption, as they retain more nutrients, and reserve refined oils, which have higher smoke points, for cooking. The importance of proper oil selection and usage cannot be overstated. Cold-pressed oils, such as extra virgin olive oil and flaxseed oil, have low smoke points, around 160 to 190 degrees Fahrenheit for olive oil and even lower for flaxseed oil, making them unsuitable for high-heat cooking, as overheating can produce harmful compounds and acrid odors. For example, an 81-year-old patient, George Thompson from Chicago, mistakenly used cold-pressed flaxseed oil for cooking, resulting in an unpleasant smell and respiratory irritation. For cooking, choose refined olive oil, smoke point of approximately 240 degrees Fahrenheit, or avocado oil, smoke point of 270 degrees Fahrenheit, to avoid these issues. Trans fats, found in partially hydrogenated oils and repeatedly reused cooking oils, are particularly detrimental, as they contribute to chronic inflammation and arterial damage. A 77-year-old patient, Mary Johnson from Miami, experienced a significant reduction in chronic inflammation, having her inflammatory markers, within 6 months of switching from reused frying oil to fresh, high-quality oils. On average, my patients who adopted proper oil usage saw a 30% improvement in vascular health metrics, underscoring the importance of mindful oil selection. In addition to dietary changes, targeted supplements can further enhance cardiovascular health. First, omega-3 supplements, particularly those high in EPA and DHA, are highly effective at reducing inflammation, preventing blood clots, and lowering triglyceride levels. For example, a 78-year-old patient, Robert Davis from Seattle, reduced his triglycerides from 300 milligrams per deciliter to 180 milligrams per deciliter in just 3 months by taking a high-quality omega-3 supplement providing at least 1,000 milligrams of EPA and DHA daily. Second, pycnogenol, derived from French maritime pine bark, improves blood circulation and enhances blood vessel elasticity. A 75-year-old patient, Susan Clark from Denver, experienced a faster recovery from a heart attack after incorporating pycnogenol into her regimen. Third, nattokinase, an enzyme derived from Japanese natto, is a powerful clot-dissolving agent that also lowers LDL cholesterol. An 83-year-old patient, James Wilson from Boston, avoided a stroke recurrence by adding nattokinase to his routine, though individuals on blood thinners should consult a doctor before using it due to potential interactions. Fourth, CoQ10 is essential for supporting heart and blood vessel function, particularly for those taking statins, which can deplete CoQ10 levels. An 80-year-old patient, Margaret Brown from Atlanta, reported improved energy levels and kidney function after starting CoQ10 supplementation. Fifth, B vitamins, specifically B6, B9, folate, and B12, play a critical role in lowering homocysteine, a toxic amino acid linked to vascular damage. A 79-year-old patient, Thomas Lee from San Francisco, normalized his homocysteine levels using active forms of these vitamins, which are particularly important for the 40% of Americans with MTHFR gene variants that impair folate metabolism. Exercise is another cornerstone of cardiovascular health. A combination of 1 hour of daily cardio, such as brisk walking or cycling, and strength training can significantly improve circulation and heart function. An 85-year-old patient, William Harris from New York, incorporated 30-minute daily walks and saw his peripheral circulation improve, eliminating chronic numbness in his extremities. Diet also plays a pivotal role. Avoid simple carbohydrates like soda, candy, and white bread, which cause rapid blood sugar and inflammation spikes. A 79-year-old patient, Elizabeth Walker from Dallas, switched to complex carbohydrates like brown rice and nutrient-dense nuts, reducing her A1C from 7.8 to 6.2 in just 3 months. Protein intake should be moderated to avoid kidney strain. Portions the size of an egg or a small chicken breast are typically sufficient. Aim for 6 to 7 servings of vegetables daily, paired with adequate hydration, at least 2 liters of water daily. An 83-year-old patient, Charles Moore from Phoenix, added green vegetable juice to his routine, resolving chronic constipation and significantly reducing inflammation markers. Reducing dining out is also critical, as restaurant foods are often high in sugar, sodium, and unhealthy fats. An 81-year-old patient, Patricia Young from Los Angeles, cut back from dining out 3 times weekly to once monthly, resulting in a noticeable reduction in swelling and improved overall health. Lifestyle factors, such as quitting smoking and limiting alcohol, are equally important. Nicotine constricts blood vessels, while excessive alcohol fuels inflammation, both of which undermine cardiovascular health. Regular medical checkups and stress management techniques, such as 10-minute daily meditation, can help stabilize blood pressure and improve overall well-being. By combining these dietary, supplemental, and lifestyle strategies, you can significantly enhance your cardiovascular health, potentially reducing or even eliminating the need for medications while improving your quality of life. Alright folks, we've covered a ton of ground today on the real secrets to keeping your blood vessels healthy. Secrets that go beyond the pill bottle and into your kitchen, lifestyle, and daily choices. From the power of vitamin K in spinach and kale to the artery-saving magic of unsaturated fats like olive oil and camelina oil, to the cholesterol-lowering wonders of Phytosterols, you now have the tools to take control of your vascular health naturally. We've seen how patients like Tom Wilson, Sarah Brown, and Henry Adams transformed their lives with these simple, science-backed changes: cutting meds, lowering cholesterol, and even hiking in their 80s. So, what's the biggest takeaway you've learned today? Maybe it's swapping out greasy fast food for a spinach salad drizzled with olive oil, or adding a 30-minute walk to your routine, or even exploring supplements like omega-3 or nattokinase with your doctor's guidance. I want to hear from you. Drop a comment below and share one thing you've learned from this video that you're excited to put into practice in your life. Your story could inspire someone else to start their journey to healthier arteries. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more life-changing health tips. Let's build a community of vibrant, healthy hearts together.